Hey, welcome to 50 and Flashing. Today is menopause assessment time. So, ladies, if you can answer yes to any of the following, it's possible that you might be entering into the first phase of menopause. So, if you have irregular periods, they could be longer, shorter, heavier, lighter, hot flashes, vaginal dryness, sleep problems, your PMS is worse, or urine leakage when you laugh, cough, or sneeze, it's possible that you could be entering into the first phase of menopause. So, with that being said, today's topic is the phases of menopause. So, ladies, the first phase is called perimenopause. Perimenopause is the transitioning phase. You're transitioning into menopause, um, where you won't no longer be able to have babies. So, the first sign that you're entering in is irregular periods. So, if you notice the change in your period, that's the first sign. You could go as long as, I guess, 11 months, because it say anything under a year, so all the way up to 11 months missing a cycle, and then bam, you could have one. So you're still in perimenopause. Your cycles could be shorter, like instead of 28 days, 20 days. So if you're noticing these things going on with your body, that's a sign. Um, Also, you might have breast tenderness. Your PMS could be worse. Um, Urine leakage is also one, and vaginal dryness. All of these are signs that you could be entering into perimenopause. So, this phase normally lasts maybe 4 years, but some people are less. And you have some people that could go all the way up to 10 years. So, with me, uh, I had been on birth control for like 10 years, and I had been discussing with my doctor that I wanted to come off the pill. And so I was 49, and he was like, well, let's take you off and see how close to menopause you are. So I came off birth control. I had one period. The next month, I had breast tenderness. And then that following month, I was having hot flashes. So mine was very short. My perimenopause symptoms, I would say, maybe lasted 2 months, but I didn't even know that's what was going on with me. So, with that being said, ladies, if you haven't missed a period for up to 12 months, you can still get pregnant. So, continue to use your form of birth control until you have missed 12 consecutive periods, a whole year. So, um, the next phase, after you miss those 12 consecutive periods, is called menopause. So, menopause is also known as the change in life. No better definition, because everything about your body is changing. The body that you once knew is becoming something else. For instance, you might have unwanted hair showing up on your chin or on your chest. Every now and then, I have to pluck out a couple whiskers off my chin. Um, you might have sleep problems. I remember I used to could sleep 8 straight hours. Not no more. I always have disrupted sleep. Let's see. There's so much. Your skin, that little bounce back elasticity that we once had, your whole body, everywhere, loses it. So, things start to droop and sag. Just be mindful that you're going through the change of life. So, your emotions could be on 100. You might be happy for a minute, sad. All this could happen within 5 minutes. You could be happy, sad, mad, ready to bite somebody's head off for nothing. Emotions will be everywhere. That's part of it. There's a slew of other symptoms that come along with menopause, like, of course, the hot flashes, the vaginal dryness, brain fog. Another one that I have is the pain in my joints. So I just never know from day to day what's going to hurt me. But that's pretty much menopause. So you go through this for about a year or two, or until your symptoms start to fade out, fade down, fade away, and then you enter into the next phase. But let me give you a positive point about menopause, the menopause phase. At least, ladies, we don't have to worry about the heavy periods anymore, the cramping. We don't have to go out and buy pads, tampons, or any other period products. So that's a good thing. And then no more birth control. So there's no more chance of having babies after you hit this point in your life. So to me, those are positive things. So moving right along, the final phase is postmenopause. Postmenopause is, like I said, the phase after everything die down. And so once you get in this phase, it's pretty much other things to worry about, like you're going to have concerns with osteoporosis, dealing with your bones, and you also might have heart disease. So those are the things that you look for once you get in postmenopause. So ladies, as we age, we just have to be aware of the things that's going to happen to our bodies, because it's going to happen. There's no way of avoiding it. So hopefully some of these points will help someone, and that's my goal, is to put the information out there and hopefully to put awareness on menopause. Thank you for watching, and please subscribe to my channel.